I don't think anyone's really ever prepared to have to deal with death. Like, I'm scared every day just knowing, like, okay, I might get a code blue today. Like, I always go in hoping for a good night, hoping that I won't have someone code on me.
Welcome to the Insider Career Conversation. I'm your host, Sylvia Juarez Magaña. As a higher ed advocate, it has become clear to me that not everyone is interested in a traditional degree path. As I started to talk to colleagues like my co-host, Brenda Castellanos-Nash, I learned that there are careers that don't need an extended education path, like a 4-year degree from a university. And equally important, these careers are vital to their fields. On this show, we will explore lesser-known careers within several different fields. We will also discuss schooling, licensing, and a typical day. This season is covering allied health with Brenda and her colleagues. Hey, Brenda, how's it going?
Hi, everybody. Just want to remind you what an allied health profession is. Allied health professionals are involved with the delivery of health or related services pertaining to the identification, evaluation, and prevention of diseases and disorders, dietary, nutrition services, rehabilitation, health systems management, among others. Allied health professionals, just to name a few, include like dental hygienists, diagnostic metal sonographers like myself, dietitians, medical technologists, occupational therapists, respiratory therapists like our guest today, and speech language pathologists. Respiratory therapists lately have been the big buzz because of COVID-19. We're really excited and really thankful to have Giselle Cano here today, who is a respiratory therapist.
Hi, happy to be here.
Hi, Giselle. Welcome. We appreciate your time and insight to your work. Can you tell us a little bit more about your profession? How did you learn about it?
I learned about it from my sister, who was doing a program in ultrasound technology, and she told me to come to her school and go to the class that was showing like a little bit of every single profession that the school offered. So I attended, and the last class that they talked about was respiratory therapy. So I didn't know what a respiratory therapist was at first. I had no idea that they even existed. So I kind of, when they spoke about it, it interested me the most, and I was like, okay, like I want this. It's fast paced. They're first on the scene, so I'm gonna look more into it. And then got into the program and just had to get on the wait list and do the prereqs for it.
That sounds super exciting, Giselle. I mean, that you actually took the opportunity to take the time to see these different fields. What interested you in terms of the associates versus a bachelor's in respiratory therapy?
Honestly, I wanted the quickest way to be done versus a 4-year.
Gotcha. No, and that's fair because a lot of individuals are looking for something that's not the traditional 4-year, let me get the bachelor's and move on, but still have an impact in what they're doing. So a little bit along the lines of education, because that's my thing. I'm understanding that you have to know a little bit about chemistry, biology, anatomy, physiology, even some math. Are those kind of the subjects that you have to cover?
Yes, and then some microbiology too. And then those are your prereqs.
Were these things that you were interested in when you were in high school or when you were in the area of thinking about or in the time frame that you were thinking about wanting to be in the health field? Because I'm assuming that's what you wanted to do, be in the health field.
Yeah, I always wanted to be in the health field. I just didn't know what I wanted to do exactly in it. And then as far as subjects, my favorite subject was science. My worst, and I still hate it, is math. Like I
Oh,
can't do
really?
math at all.
Okay. Look at
Yeah.
you. Okay. How much of math do you use in your profession right now?
Not much, actually. No.
Okay.
Usually the computers and the medicine doses figured all that out for you.
Oh, and that really nice. That way I don't have to function on that level. I like that. Okay. Our listeners will like that.
Now, do you have to convert? Did you do any kind of conversions? Because I know sometimes there's conversions with like the amount of medication you have to do, but that you said the machine takes care of all of that.
Yeah, luckily I don't have to do really much math at all, or else I'd probably suck at it a lot because I struggle with doing basic math. So that's one of my favorite parts is I don't have to worry about that kind of stuff.
That's good. Again, that's information that's
Yeah.
important. Can we talk a little bit about the licensing component, right? Because I'm assuming that to get the license, you do have to have at least an elevated understanding of these subjects that we're talking about so that you can get the license. I know in the state of California, you have to have it along with every other state except for Alaska, right?
For the testing, it's a two-part test. The first one is question-based, like multiple answers, and you can either score a higher end cut or a lower end cut. So the lower score, you are a CRT, and then the higher cut score is an RRT, which qualifies you for a second test, which would be the clinical simulations. They both do essentially the same thing. It's just the lettering behind your name. And then once you qualify for the higher cut score, that's when you do a 4-hour test. It's a lot harder and it's scenario based. And that one was pretty tough for me. Had to take that one 2 times before I passed it.
Oh, so you can take it multiple times.
Yeah, but it just costs like $220 each time.
Right. For our listeners, can you tell us what the acronyms mean? The numbers, the letters that you've shared earlier, what do they represent?
One's a certified respiratory therapist, and the other one's a registered respiratory therapist.
Got it.
So essentially, you have to take 3 exams.
It's just the two tests. So the first test is the exact same for anybody, and it just depending on how high you score that you can qualify for the second test.
Oh, so it's qualification. So you don't determine which one you want. Your testing determines which one you pursue.
Yes, correct.
Ooh, that's deep, Brenda. I don't know if I could
I
have done that.
know. So do you mind, Giselle, if we ask you which ones you got and how long it took you to get what you got?
Um, so the TMC is the multiple choice one. I passed that one with a higher score on the first time, which let me qualify for the second test. And that's the one that I took about a month to 2 months to study for it before I scheduled it and took that one. I think the first time I wasn't studying the right material and I didn't pass it by like 20 points. So I gave myself a week and a half and rescheduled it and then took it a second time. And then I was off by like maybe 4 points the second time. So obviously I was getting frustrated. I started to lose hope. I wanted to give up on the career. And I was like, okay, like maybe I'm not meant to be an RRT. Like I just lost hope a lot because I just was so down on myself. And then I told myself, okay, like just you're gonna keep trying until you pass it. So then I gave myself, I think, 2 more weeks to reschedule the test. And I ended up passing it the third time. And it was such a relief. I was so happy.
That's wonderful, Giselle. I mean, I hate that you had this struggle. Can you tell us a little bit about how you kind of come back from that? How do you come back from feeling like maybe this isn't even for me? Here I am wanting to pursue this.
Honestly, a lot of it had to do with the support of my family and just their confidence in me and saying that I was going to pass the test, even though I lost confidence in myself. Like I was always constantly getting family and friends telling me, like, you're going to pass it, just keep studying. And I asked friends who had passed it, like tips and tricks, what they used to help them pass. So then I just kind of told myself, okay, like keep trying. You're gonna like, there's no way you're not gonna pass this test. So I would just study. But honestly, what helped me the most with passing the test was Kettering. So I would definitely recommend get Kettering while you're in school. Purchase the practice tokens because that helped me a lot.
Can you tell us what Kettering is?
So Kettering is this program that's offered after you grad. Well, I don't know if you could take it before school, but usually they offer it after you graduate, and it's kind of this
It's like
like
a test prep?
yeah, it's like a test prep, and they teach you a class. Basically, they teach you what the test is going to be like. I didn't take the course, but I did purchase the tokens because I think it was like a $300-400 course to take after, and they basically tell you like the cheat ways of doing math quickly because the test it consists of everything you learn in school, all these math equations and formulas that you have to remember. So they teach you cheat ways of like, okay, here's a quick way of doing this math equation instead of taking like the 10 minutes to do every single step.
There's
And
that
they'll teach
math
you like,
again.
okay,
Huh,
yeah, and
Giselle?
then they
There's that
teach you like,
math.
okay, they're going to be like, hey, they're going to ask this kind of question. This is the way they're going to ask it. This is what they're looking for. So like think outside of the box kind of. And then even on their website, it teaches you too. And there's different programs. I think I honestly forgot what it's called. It started with a J, but there's different programs that you could do. But Kettering is by far the best one.
So can you tell us a little bit about what would be the component to your continued education, and then how do you renew your license?
So for license renewal, it's required every 3 years, and it's a fee that you would pay. But with each license renewal, they require 15 units of continued education. And then with the National Board of Respiratory Care, they require your continued education every 4 to 5 years, which is 30 units total. So with that, you can find continued education units through online. They're free. You can watch small videos and they give you a small test at the end, or you can attend seminars or conferences that they hold every year. And it's a 3 day conference in a different state. And then those 3 days will count for like 26 total units.
Awesome. That's great because that gives you exposure to different places, and it's not necessarily just your regional environment. It could be anywhere throughout the nation, which is important. And hopefully, listeners can modify that to their understanding of what they want to pursue with respiratory therapy. So, after everything is said and done, Giselle, depending on your level of education, of course, your salary could be between 47,000 and 59,000 to start.
Yeah, you can make like as little as 40,000 to as much as 100,000 or over per year. It just depends your years of experience, how often you're willing to work, because the hours are always going to be there. People are always going to get sick. So, and especially actually during this time right now, during COVID, like we were so understaffed. We need so much help, even with all of us working. I think we had at one point like 23 therapists a night, and we were still just struggling and understaffed. But yeah, the hours are there. So depending on how much and you're willing to work and how much you want to see yourself make, you choose if you want to keep work more, if you want to just like, take it down a notch and be like just chill a little bit. But the salary is there, 40, like 100,000.
So, Giselle, can you tell us about a typical day in the life of a respiratory therapist?
Yes. Okay. So I'll tell you two versus COVID versus now. So during COVID, I would go in, get a report. There was usually I'm do night shift mostly. There would be about 23 of us coming in. And on average, the normal we should have is about 9 RTs a night. So 23 is already more than double for us. We would get reports, and that during COVID times, like we were at a point when we were getting 6 to 7 ventilators each, which when the normal is three max. And we were doing treatments, and they were just constant code blue. So you never really had downtime. It was just on your feet the whole time. Like there were times like maybe 20 minutes after my shift, there was already a code blue being called. So I'd have to run. We all have to run over there, try and see what's going on, try and save this patient. And sometimes we just didn't get lucky. COVID was a very strong disease that just didn't have a high survival rate with the patients that we had, because a lot of them was attacking older people, and it would just their lungs were being destroyed. So it was constantly busy. We constantly had patients coming in.
Can you explain what a code blue is?
Is usually a cardiac arrest when your heart stops pumping and we've lost the pulse. So at that point, we have to start doing compressions. If they're not intubated already, we have to figure out, okay, like are we going to intubate them, or is the family like does the family want to be they want them to be a DNR and just not resuscitate them? It just code blue is basically trying to get that person back to getting a heart rate.
What would your role be when you're in there as a respiratory therapist? And who else is in the team?
First off, I have to focus on just the respiratory, anything from the waist up, the lungs, making sure their airway is open, there's nothing in the way, they're breathing. If they're not breathing, I'm in charge of going to the head of the bed. So we have this thing called a bag valve mask, and it's like an ambu bag that you put a mask over their face, and then you are breathing for them. So you're giving them breaths every 3 to 5 seconds, and you always have to connect them to oxygen. So I'm in charge of just making sure they're getting that airway ventilation. And sometimes if they need help, and there's enough people or another respiratory therapist, then also we can also jump into compressions and help with compressions. But that's my main focus. I shouldn't be doing anything else but focusing on either compressions or giving them breaths. And I help the doctor if they decide to intubate, then I'm in charge of setting up the intubation tray ready and getting a tube ready, like a size bigger or smaller, getting the camera ready for the doctor to be able to intubate and look inside their throat. And I'm in charge of getting a whole, like taping and securing the tube to their face. And then on the team there, there is nurses. There's other nurses, and I don't really know what a nurse's job is. Like I don't really focus on what they're doing because I'm too focused on what I'm doing. But I know there's nurses there giving medicines, epinephrine. Usually, there's a code lead to help run the code smoothly and telling you like, okay, give them a round of epi, give them this, and then there's also another person who's there just writing everything down at what time we give it, what time we're doing it, how long we're doing it, how long they lost their pulse for, because we need to document everything that we're doing per minute. And then if we have, and sometimes we've gone as long as an hour during codes, just trying to get a pulse back. And then there's also someone in charge to call the families, letting them know, like, hey, this is going on. What would you like to do? Do you want us to continue? Do you want us to do everything we can? And there are times where like we just don't succeed, and then the code lead will either say, okay, like, is there anything else that someone can think of that we can do if we're not getting a pulse? And if everyone agrees that we can't, then they'll be like, okay, like I'm calling it, and they'll be like, okay, time of death. And then they'll say the time. And then at that point, we all stop what we're doing.
And I know that all of us have been impacted in terms of our mental health with the pandemic. I know as someone that has been part of the environment, the community, right? I'm impacted in one way. I can't begin to imagine the community that takes care of those individuals that actually do have a medical emergency due to COVID or even outside. How did you prepare for the mental strength to be a part of some decisions that could either bring somebody back or not? Or do you think it's one of those things where you walk in every day and say, okay, let me just, get through my shift?
I mean, I don't think anyone's really ever prepared to have to deal with death. Like, I'm scared every day just knowing, like, okay, I might get a code blue today. Like, I always go in hoping for a good night, hoping that I won't have someone code on me. But I mean, in the moment, everything's happening so fast that you don't have time to think about what you're feeling. You're just in the moment, like, okay, like my goal is to just do what I have to do and see what happens. Then it's not till afterwards that it kicks in. Like, okay, like there are some patients that like really get to you. I've had a couple of those, and then there's sometimes it's just it happens so. I hate to say it, but sometimes it happens so often that you just kind of get used to it because you still have other patients to take care of. So it's kind of like a code happens, but you still have to be like, okay, like this person died, it sucks, but I still have other patients to go take care of. Like my night's not over yet.
Right. And I think this is probably, I'd like to thank you for what you've done for those of us that are listening and have experienced it. And whether in our family, our friends, or community, I'd like to thank you for those that didn't get to thank you personally for that, because it's got to be a toll. And this is being part of the medical field. Whether you're someone that is responsible in one way, in your case, it's through the respiratory aspect of things, but you're part of a team that's really hoping to have, like you said, a good night. Can you tell us a little bit about some inspiring moments that have happened while you've been on the job that you're just like, okay, this is exactly why I do what I do and why I'm here right now, this second?
I mean, the best part of the job is probably, or like when you're there, is probably seeing people get better when you saw them at their worst and their lowest, and you see the progression of how they like are able to get weaned off the ventilator, and then they go to like breathing on their own and doing spontaneous breathing trials, and then eventually they get the tube taken out, and then they're finally like just no don't need any machines, don't need any oxygen. It's just and then seeing them be able to go back home. It's just seeing the progression of everyone's health getting better.
Is there like a story or a situation that stands out in your mind that's the most memorable thus far? Like you can think back and be like, wow, this family or this patient really impacted me.
It's not a happy story, but the story that made me realize, like, okay, like this is what I want to do is it was actually during my first time in clinical as well. I was still in school. I'd never stepped foot in a hospital. I didn't know what anything was like. The only time I was in the hospital was if I had doctor's appointments. And On my first day there, within the first 2 hours, they had a code blue card that was coming in. And it was, I forgot how old he was, but it was this guy who I think it was alcohol poisoning that he had. And I was scared because I've never experienced that at all. And I was like, my heart was pounding, and my mentor was with me. And she said, okay, she goes, you're gonna, she was basically walking me through it. And she's like, okay, there's a patient coming in. You're gonna focus on their breathing. That's all you should focus on. She goes, don't worry about anything else. And they brought him in. And I remember seeing like this team of people coming in, and then they were doing compressions on him. And I was so nervous. I almost thought I was gonna black out and faint, but I was like, no, like I gotta keep it together. Like I can't faint on my first day. So I was giving him breaths, and I just how calm the whole team was instead of just yelling and being chaotic all over the place. Like there was the doctor was so calm about saying, okay, like he would you're gonna do this, you can do this, and then there was other RTs that came, and they were all just speaking to me, and they're like, okay, just focus on our voice, like this is what you're gonna be doing, like you want to jump on compressions and just see what it feels like to do compressions on someone. And I think that experience of it, like how it was working as a team, made me be like, okay, like I'm not on my own. I'm gonna always have someone helping me. I'm never gonna have to make a decision by myself if I'm not sure. And that moment right there stood out to me, and I was like, okay, like I'm gonna like this.
That's amazing that you've always known this is a field you wanted to get into in the early years. Were you a team player? Were you someone that was, someone that always wanted to be around folks and, work together to get something accomplished? Was that something has been part
Yeah,
of your
I've always like
personality?
yeah, I've always liked being in groups or doing group projects.
I think sometimes we know we're going down a path, but we don't know how our soft skills are also leading us down that path as well. And I think when I talk to students, I do try and stay within that personality of what it is because, you don't want to go so far off that's against what your personality is that you also have to work on getting yourself there.
Can you tell us a little bit about what you mentioned before that you had no experience in being in a clinical setting? What was your experience? What were your jobs prior to this? Like, and if you could tell us a little bit about what experience you did have and what was it in, and what you feel the experience, your previous experience in your other jobs helped you in this field.
I mostly worked in customer service. Right before this job, I worked as a cashier at a pizza place. I also worked at Disney for 5 years. So I was always dealing with people, and just I think that helped me just have it be easier to talk to patients because like I always think about how they're sitting there alone, and like they don't have anyone. Some people don't have anyone come and visit them, and I just try and put myself in their shoes. Like, okay, imagine being in a hospital room. You're there day in and day out. You can't go outside. You don't have any interaction besides the people who come and see you, like your nurses and your RTs and your doctors. So I always try and like have a conversation with them because I would hate it if I was just there and people just treated me as a job versus like treating me as a human and trying to see like how am I doing, what's going on, like ask me questions. So I always try and ask questions and try and like stay what little time I have with them, get a conversation going. I mean, there are times where I'm so busy that I can't talk to them, but I always try and make an effort to just try and make their day better because I know it already sucks to be in a hospital and you don't have anyone visiting you.
I think that's great because you have that, the fact that you have that empathy and that you appreciate the patients and that you treat them as human beings versus a job. I think that speaks volumes. And you've got that bedside care that a lot of times being in the hospital, sometimes we don't see. So that really makes you stand out. And again, like, just to piggyback off of what Sylvia said, I appreciate you for that. And I'm absolutely positive that those patients and the families of those patients really appreciate that also. I mean, the little thing that you do goes a really, really long way. And you are impacting those people's lives, not only as a team, but also as an individual. So thank you for doing that.
It is amazing, like Brenda's saying, to have individuals come in and at least smile at you and ask you if you're okay. And, that sometimes you don't think of that when you're thinking about somebody being in the hospital. So our listeners are hopefully getting the idea that you're part of a team. You are part of a community that's helping others get through probably their worst moments, but getting through their worst moments in a way that's telling of how we should come together as a community?
I mean, don't get me wrong, it's not always fast paced. There are some times where I have a little bit of downtime during my rounds and stuff. So if anyone's ever like anyone listening is worried about like, oh my God, I have to do nonstop work all 12 hours. Like it's not like that either.
Right.
You do have
Right.
downtime.
You're giving us peaks.
Yeah, I
Yeah.
mean it's not a job to be scared of. Like there you do have some easy days where sometimes the hours just drag and you're like, okay, like I want something to do. You know, you have some slow days, but you also have some busy days that make up for it.
So are you working a three-day 12-hour shift, or how does your week broke?
So right now I'm per diem. So I'm only required to work once a week, but I can pick up as many shifts as I want. And if they need someone to come in, then they'll call me. What I like about per diem is I make my own schedule and I don't get penalized for saying like, no, I don't want to come in, or I don't get penalized for saying I'm not gonna, like I can choose some weeks where like I don't even put myself on the schedule. I can go like a week without working, or I can go a week with working every day.
So your employer takes care of that. You're not part of an agency.
Yeah, my employer.
Your employer takes care of that. That's
Mhm.
awesome. So what do you see your next steps being?
For right now, I do see myself sticking with this for a while, but I have thought about eventually going back to school. When I was younger, I used to want to be a doctor, a plastic surgeon. So I still think about that from here and then, seeing if I still want to pursue it or even pursue psychiatrist because I do want to help people with mental disabilities and disabilities because I've struggled with that too. So I would want to help back.
Oh, well then here we go, Brenda. Got to bring her back
I
for
know,
that.
gotta bring her back. Once she becomes a psychiatrist and she goes to medical school, that'll be another podcast, the
Yeah.
future of Giselle.
Thank you so much, Giselle, for your insight. Brenda, this conversation was awesome, and thanks for guiding us through the allied health professions. I know, as usual, I've learned a lot.
Me too. It's definitely eye-opener. And I'm so looking forward to seeing how this all comes together and hopefully motivating some listeners out there who always thought about going to the medical field, but were intimidated by it. I think Giselle was the perfect guest. She always thought about going to medical school and it didn't work out for her. So she ended up in the medical field as a respiratory therapist and is making good money and loves what she's doing. So thank you, Giselle, again for coming on today.
Thank you for having me.
Thank you, Giselle. I really appreciate you being on the show, talking to us like big sisters. So I appreciate all that. And for our listeners, we are continuing the series. So we want you to stay tuned for more insider career conversations that showcase career paths. I appreciate you listening and look forward to our next conversation.
That's a wrap for Season 1 of Insider Career Conversations. Season 2 is coming soon, and we'll be moving away from allied health and into a completely new subsect of hidden careers. So stay tuned. Insider Career Conversations is a production of Juarez Consulting. For more information, you can visit juarezconsultinginc.com. This episode was produced by Sylvia Juarez Magana, with production help and editing by Kazmira Hall.